Good afternoon, everybody, and thank you for joining today's briefing. We've had 10,541 new COVID cases since Friday's report. We have 1,630 people in the hospital with COVID, and sadly, 19,167 people who've died. Now, with holiday gatherings, COVID cases beginning to rise, and a new highly contagious variant on the way, we're here today with some important messages about how to keep yourself and your family protected over the next few weeks. These actions are urgent as North Carolina and the nation brace for the impact of the even more contagious Omicron variant of COVID-19. First, get boosted. If you're eligible for a booster, get one right away. I know people might want to wait until after the holidays, but don't. Get a booster as soon as possible if you're eligible. I can't stress this enough because it adds an important layer of protection, particularly against the Omicron variant. Second, get tested. If you plan to gather with family and friends, find a way to get tested before you do. Schedule an appointment or have at-home rapid tests ready. We are urging our partners to ramp up testing statewide to make it more available. And incoming North Carolina Department of Health and Human Services Secretary Cody Kinsley will share more about that in a minute. Third, get vaccinated if you hadn't done it. COVID remains a deadly risk for those who have not been vaccinated. The Omicron wave is more contagious than Delta, and only weeks and maybe even a few days away. If you aren't yet vaccinated against COVID, please make the right decision and get your first shot. Lastly, when you're indoors in public, wear a mask. The Omicron variant is spreading fast, and a mask can help reduce the chance people get infected. Right now, these are the best safety precautions to avoid serious illness. Do them yourself and insist that others around you do them too. Many people are going to get infected, including some who are vaccinated. But the most important difference between vaccinated and unvaccinated is how sick you get. The evidence is clear that vaccinated and especially boosted people are so much safer. Despite these serious concerns, we're in a much stronger position this holiday season compared to last for one main reason: the remarkable COVID-19 vaccines that are saving lives every day. When I think of things I'm grateful for this Christmas, this vaccine is a big one. At this time, I'm going to ask Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, to share more information about what we know about Omicron and what people can do to protect themselves. Dr. Cohen.
Thank you, Governor. I have two messages for North Carolinians today. First, the newest variant of COVID-19, Omicron, is the most contagious we've seen yet and will likely set record high daily case numbers in the coming weeks. Second, and most importantly, you can act now to best protect yourself and your family and friends. So let's start with what we know about Omicron to date. Evidence suggests that it is 2 to 3 times as contagious as the Delta variant, making it 4 to 6 times as contagious as the original COVID-19 virus. Fortunately, early evidence suggests that illness from the Omicron variant may be less severe. However, it still can pose a danger for people who are not vaccinated, and particularly those at higher risk of severe disease. We are already seeing record high numbers of COVID-19 cases around the world, as well as in the United States. Earlier this week, New York had its highest number of cases reported in a day since the start of the pandemic. This is not, however, a moment to throw up our arms in the air. It is a moment to act. There are things we can do right now to protect people and to make sure there is enough hospital care for everyone who needs it. First, as the governor said, boosters are critical. Early evidence shows that boosters provide a significant level of protection against Omicron, And I urge everyone who's been vaccinated to get your booster as soon as you are eligible. Do not wait. Getting a booster is particularly important for people who are at high risk for severe disease. That means if you are 65 and older, you need a booster now. If you have an underlying medical condition, you need a booster now. If you live or work in a long-term care facility, you need a booster now. If you are a healthcare worker, you need a booster now. As a reminder, if you got the Moderna or Pfizer vaccine, you should get your booster at least 6 months after your second shot. And if you got the Johnson & Johnson vaccine, you should get a booster at least 2 months after your shot. Second, it is not too late to decide to get vaccinated. While you won't be fully vaccinated for several weeks, with each shot, you will get more protection from severe illness, hospitalization, and death. Like Delta, Omicron will cause the most suffering among those who are not vaccinated. Third, we still need to mask. Everyone, even if you're vaccinated, should wear a mask in public indoor spaces. And if possible, wear a medical grade mask for more protection. Medical grade masks include surgical masks, procedural masks, a KN95 mask like the one I'm wearing today, or an N95. As we head into the holidays, there are additional precautions you can take to protect your loved ones and yourself. Let's first talk about traveling. You should only travel if you're fully vaccinated against COVID-19 and have had your booster. If you do travel, wear a medical grade mask, even if you're vaccinated and boosted, and you should get tested 1 to 2 days before traveling. The safest way to get together with friends and family is to make sure everyone who attends is vaccinated and boosted if they're eligible. Everyone should also get tested 1 to 2 days before gathering. Keep gatherings small and host them outdoors when possible. If you do gather inside, use a space that allows you to space out and open up windows and doors to increase airflow. And of course, if you are sick or have symptoms, do not host or attend a gathering and make sure to get tested. Today, we've released a secretarial advisory that outlines everything I just discussed. And incoming Secretary Cody Kinsley will share more about our efforts to support testing across the state, as well as support our hospitals and other healthcare partners. Based on what we've seen in other parts of the world, we're expecting to see many more cases here in North Carolina in the coming weeks and months, even among those vaccinated. However, while vaccines may not prevent some people from getting COVID-19 infection, they do provide strong protection against severe illness, hospitalization, and death. I imagine that many of you, like me, are frustrated to head into yet another holiday season under the shadow of this pandemic. However, there's a major difference this year. We have the strongest tools available to protect our health: vaccines. It's urgent to act now to protect yourself and your family and friends. Get vaccinated, get boosted as soon as you are eligible. Thank you, Governor.
Thanks, Dr. Cohen. We thought last week might be your last time at the podium, but this pandemic continues to throw us curveballs. So we appreciate your dedication right up to the end of the year. Now I'm pleased to ask Cody Kinsley, the current Chief Deputy Secretary and soon-to-be Secretary of the North Carolina Department of Health and Human Services, to share more about the state's work to prepare for the logistics of battling this latest surge. Cody?
Thank you, Governor Cooper and Secretary Cohen. As the Omicron variant spreads across North Carolina, we are preparing for the impact of a potential record high surge in cases and hospitalizations. To prepare, we are focusing on 3 things. First, protecting the most vulnerable to COVID-19, those who live in nursing homes and other long-term care facilities. Second, supporting hospitals to have enough hospital beds to serve patients sick with COVID-19 and other emergencies. Finally, ensuring North Carolinians have access to testing. We have been working closely with long-term care facilities across the state to encourage booster shots for both residents and staff. We are ensuring each facility has easy access to vaccinations and a ready partner to administer those critical shots. We want our state-operated healthcare facilities to lead by example, and they are. As of today, more than 90% of eligible residents in our state-operated long-term care facilities have received their booster. As COVID-19 infections increase, we expect cases of severe illness, particularly of unvaccinated people, to rise as well. Therefore, second, we must do what we can to maintain hospital capacity so that everyone has access to the care they need, whether that's for COVID-19 or a heart attack or a car accident or cancer treatment. Our hospitals are beginning to show signs of strain as cases grow. We have just over 20,000 inpatient beds in North Carolina. As of yesterday, 78% of them were filled. In the ICU, we're at 81% of capacity. We are working with hospital systems across the state to coordinate preparedness measures to preserve inpatient bed capacity, some of which are already going into effect. The state emergency response team is also ready to activate our system to coordinate patient transfers from overcrowded hospitals to those with available beds. And we know we will once again be calling on our frontline heroes who have gone above and beyond for almost 2 years. To protect their health, we are encouraging all hospital staff to get boosters. I want to emphasize that everyone can help protect hospital capacity by following the guidance outlined by Secretary Cohen. Vaccinate, boost, test, and mask. If you haven't gotten vaccinated, it is not too late. Finally, testing is another important tool. As Secretary Cohen outlined, testing before you gather can help slow the spread of Omicron. And if you test positive, quickly seeking out treatment can help reduce the risk of severe disease. Testing is available across the state. During the Delta wave, labs across the state were processing upwards of 86,000 tests per day with turnaround times of 1.5 days on average. Because of the work of the federal government and the private sector, we also now see significantly more at-home testing available. We are communicating closely with our testing vendors, laboratories, and the federal government to closely monitor testing supply, and will work to ensure testing is available for priority populations. If you are in need of testing, there are free testing sites and home testing options readily available. Visit ncdhhs.gov/gettested, where you will find testing locations, no-cost options, and how to order home test kits. We and our partners are doing all that we can to protect those at most risk of severe illness from COVID-19 and to ensure that our hospitals are there for those who need care. I ask North Carolinians to also do their part. You can protect yourself and your family and friends by getting your booster shot as soon as you are eligible. And if you are not already vaccinated, get your COVID-19 vaccine now.
Thank you, Cody. We appreciate your team's work through the holidays to make sure that our state's prepared. I know people are frustrated and dismayed by this wave of infection right here at Christmas. But it's important to remember how far we have come in our fight against this disease. We know what works: vaccines, boosters, testing, and masks when needed. With every dose, we're getting closer to turning the tide of this sickness and death brought on by the pandemic. And as Christmas approaches, I am grateful for the opportunity to lead the state that I love so much. My family is vaccinated and boosted, so we will get tested, then gather for food, prayer, presents, hugs, and time with each other. I am also grateful for healthcare workers, for our first responders, and all of the volunteers who keep working every day to keep us healthy and safe. Also with us today is our Secretary of the Department of Public Safety, Eddie Buffalo, and North Carolina Director of Emergency Management, Will Ray. Our sign language interpreter is Mark Lineberger, and behind the scenes, Jasmine Mativier and Angie Chivoni are our Spanish language interpreters. We'll now open the floor for in-person media who are here and open for questions. Laura? Sorry.
Rose can go.
I can't see because of the light.
Oh, sorry. Rose, that's Rose Hoban. Rose.
Oh, hey, Rose.
Hi, how are
Sorry.
you? Rose Hoban, and children.
So we want to encourage as much testing as we possibly can. And I know we have supplied some significant amount of tests to our schools, but which one of you, Cody, you want to take that one?
Thank you, Governor, and thanks, Rose, for the question. Over the last several weeks, we've pushed out hundreds of thousands of rapid tests to our local health departments that have been working to make them available in local communities. And of course, we have statewide testing vendors that are providing testing in schools to address the testing question that you mentioned. And we'll still encourage folks to go onto our website, because there you can actually get testing kits mailed to your house that are free of charge. So there's a lot of testing options available to folks, including at-home ones.
Testing website.
Yeah, it's ncdhhs.gov/get-tested.
Now, there's less of an ability to track the results of those rapid tests, right? Because they don't get, sent to a central lab. Are you thinking about some kind of app or something where people can sort of upload their test results so you can sort of track what's happening around the state?
I think the at-home tests have different purposes. And so, we don't necessarily need all of that information reported to us. I think what's important is guidance for providers on if someone were to come in with a positive at-home COVID test, that they can use that to either begin a course of treatment or whatever steps that they need to make in place. What's most important about the at-home test is that it immediately gives you information on how best to protect yourself and others.
And then I have one other question, and this is probably for the governor. What are you folks doing to increase access to booster shots for prison staff and prisoners in the state's carceral facilities?
So we want access to all kinds of vaccinations across the state, including in our Department of Corrections. And I don't know if Secretary Buffalo or Dr. Cohen would want to answer specifically that question, but we know we want vaccines as many places as we possibly can. One of the things I know we've done is offered incentives for corrections officers to get vaccinated. So it's critically important that we get vaccines and boosters all across the state.
We still have a somewhat lower rate than, say, healthcare workers and other folks. How can you, because once it gets into a prison, it just...
Right. So we have been, I think, successful in getting a lot of inmates vaccinated, and we are continuing to make progress on getting corrections officers vaccinated. Overall, since I signed the executive order, we've seen a surge in vaccinations among state employees by about 10%. And so we're going to continue to push this effort to get more people vaccinated.
Okay, thank you.
Laura Leslie, WRAL. Okay, a few questions. Number one, and I don't know who can best address this. When do you expect Omicron to become the dominant strain in North Carolina? About how long is the window that we're looking at?
So Dr. Cohen, I'll let you tackle that.
Thanks, Laura. So right now, the dominant variant is Delta. So that is what we are seeing predominantly across the state. But the speed at which Omicron is moving that we are seeing both in Europe now in the Northeast. We expect that here within the next couple of weeks. We're already seeing an increase in the number of Omicron cases that we're seeing all across the state. We've identified our first cases, but now we're really sequencing it from nearly all of our major hospital systems. And so I believe by the first week of January, certainly into the second week of January, that it may be it's certainly rising to the predominant variant, and then we may have both Delta and Omicron side by side for a number of weeks. But that's what we're getting prepared for. It's why folks need to get boosters now. There's still time. If you go out and get a booster today, you are going to be fully vaccinated, right, by the early part of January and boosted. So that's why it's really important for folks to act right now.
Did you, just to clarify, did you just say that all of your major hospitals are finding Omicron?
Nearly all are able to sequence it, and I would say the vast majority are already finding cases. Again, it's not the dominant one yet, but it is in all parts of our state. Not surprising, it is incredibly contagious. It is moving very fast. That's why we're doing this briefing today, to make sure folks know to act quickly.
And one follow-up question on that. There's reporting this weekend by the Associated Press regarding monoclonal antibody treatments for Omicron, and the reporting seemed to indicate that the two sort of most broadly available monoclonal antibody treatments are looking at possibly reduced effectiveness, and that there's one that seems to work really well, but it's hard to get. Do we have that in the state?
Yeah.
Are we getting it?
So great question. So Laura's talking about some of the treatment options that we've been using to fight Delta. And they've worked very well in Delta, but they've always been limited in terms of supply. But right now we've been able to keep up with the amount of supply with what is needed. As we move to Omicron, we are seeing much decreased effectiveness of these treatments. It's why you hear in our message this urgency about folks getting vaccinated and boosted, because that's going to be the best protection, because our treatment options are going to become less effective here with Omicron. Now, there are a couple of new treatments on the horizon. They're a couple weeks away from, we think, getting full approval, the pill, both the Merck pill and the Pfizer pill, in terms of having effectiveness against Omicron. But what we know about those is the supply is going to be very low. So I think it's going to be till the end of January, maybe even into February, before we see that being something we can have here in North Carolina for most folks. So we're going to be in January with a very contagious virus without a treatment that really works. But we do have vaccines and boosters. We do have tests. We do have masks, and we need to use those tools. Thanks.
Thank you.
Jason DeBruin with North Carolina Public Radio. Maybe just another one on testing. You said that we have hundreds of thousands, or you've even sent out hundreds of thousands. Do you have maybe a more exact number of how many tests there are available for free? I ask specifically because I do have one. The ones that you buy at the pharmacy are like $25, which can get cost prohibitive pretty quickly. So I wonder if maybe you could just talk a little bit more specifically about the free ones, and maybe tack onto that, if somebody does go to the website, what can they expect to see? What type of information is on there, to help them get actually linked up with one of those free tests?
Cody Kinsley is recognized.
Thanks, Jason, for the question. So I'll have to get back to you on the exact number of what we've sent out to local health departments. That has been a program that's been in play for some time. We've been actively pushing out as they've been focusing on serving especially our historically marginalized populations that may not be able to go out and easily access the test over the market. If you go to our website that I mentioned earlier, ncdhhs.gov/get-tested, there you'll find first a testing locator tool that'll get you connected to many of the pharmacies across the state, CVS and Walgreens most notably, but many others that are offering testing. We know that while they'll collect your insurance information, they won't balance bill you. And if you don't have insurance, it's still free. So going to one of those testing locations at one of those pharmacies is a good tool. We also, on that website, list out a number of community testing sites that the state has been sponsoring for the last 21 months, essentially. And there you'll be able to go to those. Those are also completely free of charge because the state is funding those. And we've been very intentional about where we put them. We've been looking at communities with high social vulnerable indices, and they may not be able to afford testing otherwise. And so we want to make sure that that is available. Finally, on our site, you can also request an at-home kit be mailed to you. This kit in particular is actually a PCR test that is done in partnership with LabCorp and what I believe was formerly known as Pixel. And so that's mailed to you. It arrives almost the same day, if not the next day. You can send that back and get that result. And so there's a lot of tools available. We are continuing to secure more testing resources, and we'll make those available. We know that both in preparation for travel, keeping our schools open, protecting our healthcare workforce, testing is an important tool, and we'll continue to work on that. Thank you.
These may be primarily for Dr. Cohen, but I did want to ask, with the comments you made about the likelihood of us seeing a record number of COVID-19 cases, you're also expecting that to translate to a record number of people ending up in the hospital due to COVID-19 as well?
Thanks, Michael. So yes, we are expecting record numbers of cases. I do not yet know what that will translate into in terms of hospitalizations. What we are seeing with Omicron is it does seem to be less severe. What we don't know yet is how it's going to behave here in the United States. With the level of vaccinations that we've had, the kinds of infections that we've seen before, I don't know what that will mean. We are certainly planning to see additional strain on our hospitals. It's why we are working with our hospitals to be ready. And the more we can act right now, that's what will protect folks. That's why we want folks to get vaccinated, get boosted right now to protect them, so that if they do get COVID, it can be mild and it doesn't send them to the hospital or even take their life.
What kind of projections are we looking at when you say record case numbers? Are we talking a little bit more than the peak in January, substantially more, doubling? Can you help put this into context, what we're talking about?
Sure. I'd say substantially more than even the highest number of cases that we've seen in the Delta surge. So as many, I don't want to give specifics here, but I think we could see as many as 10,000 cases a day at the peak. It is that infectious. And so we need to make sure that we are acting now to make sure that folks are protected. That's why you need to get boosters, get tested, get masks, and use the layers of protection.
I wanted to clarify something you said about only traveling if you've had the vaccine and gotten the booster. What about people who are not yet eligible to get the booster shot? Should they be changing or canceling their holiday plans?
So I would say that if you are fully vaccinated, so you've gotten 2 doses of the Moderna or the Pfizer, and you are not yet eligible for a booster, you are considered fully vaccinated. But then you want to take the additional precautions I was talking about, which is get tested 1 or 2 days before traveling or before gathering, and making sure you're wearing a mask in public settings. And the kind of mask, importantly, we're being really precise to say, if you can, to wear a medical grade mask. It'll provide even a higher level of protection than just a cloth mask.
Do you anticipate the definition of being fully vaccinated to change? Will we stop referring to these as booster shots and it being the 3rd shot of a 3-dose vaccine?
I do anticipate over time that the definition of fully vaccinated will change. It has not yet. And that is something that the CDC, I know, is already looking at as we better understand this virus, understand what that means for the effectiveness of our protection from vaccines. That may be something that will change, and I expect it to over time. It's not there yet, but we don't want to wait for that definition to change. We want folks to get boosted right now.
And then my last question, this is somewhat specific. If someone's had a COVID exposure, but they're asymptomatic, do they need to wait until they test negative before they go out and get the booster shot so they're not at risk of potentially exposing anybody? Or could they, in theory, go out today?
So if you've been exposed to COVID and you say, oh, I want to get my booster today, you can go out and get your booster, but please be wearing a mask the entire time. You are someone who has been exposed. You should be testing yourself and you should be wearing a mask, but don't let that keep you from getting a booster. Thank you.
Good afternoon, Governor. Jonah Kaplan with ABC 11. I appreciate all your patience as I go through these. Also, thanks for the people waiting on the phone. Let's start with this because, and for incoming Secretary Kessler, you said that the tests are readily available. Where? I think there's a lot of people going to these pharmacies, especially to buy these $25, $30 packs. They're not finding them. And because they're not finding them, then they're trying to scramble to go to these other places. So can you confidently say, and I think, can you clarify, 86,000 tests a day is what you're going through now?
Cody
Kinsley, I'm sorry.
Thanks for the question. So 86,000 tests a day is what our kind of high water mark line was during the Delta surge. We're significantly lower than that right now. We have been speaking often with many of our labs that perform testing in the state. They've all indicated that they have significant room to grow as far as the type of testing that they can provide. Now, of course, that's all PCR testing and what's done in labs. So what I would encourage folks is that, go to our website and identify other places that you may not immediately find the at-home test you're looking for at a certain place, but there are many other places that are providing testing. And so we have a lot of confidence that will continue to grow. We're going to have to watch it really carefully, and we are. Confident that in the near term we are, but again, we're going to have to watch it very closely as cases rise.
Okay. Does it matter if someone tests positive and it's Omicron or Delta? Does that matter?
Well, first, when someone tests positive, they won't know whether it's Delta or Omicron. They'll just know positive or negative. And the thing to know if you test positive is that you don't want to spread it to others. So that is the time where you want to be both staying at home, making sure you're doing your best to isolate yourself from other family members so you don't spread it. I will say if your test does go to the state lab, it does get sequenced and we do find out whether or not it will be Delta or Omicron. But from an individual, it really doesn't make a difference in terms of what you should be doing. We want you to monitor your symptoms. Obviously, if you're having any difficulty breathing or anything, please call your doctor and make sure that you're getting the help that you need.
It sounds like the tone of this, not that all the other briefings were not serious, but this one certainly has a lot of urgency to it. And a lot of it's back to the basics. It's the masks, it's the testing. Let's go back to even before this, which is what happens when you're positive. So if someone is unvaccinated, let's do that first. If someone is unvaccinated, what should that person do if he or she tests positive?
Sure. So if you test positive and you are unvaccinated, you want to be monitoring your symptoms and you also want to be staying isolated from others, particularly others who could get very sick or who might be unvaccinated as well. So you don't want to be spreading this to others and you want to be monitoring your own symptoms. So again, making sure that you're doing the normal things you do when you're not feeling well, which is get rest, get fluids, making sure that you are taking Tylenol or Advil to keep your fever down. But it also, if your symptoms progress, make sure you're being in touch with your doctor because they may want to try to make sure you get one of the treatments that's available. As we know, as we were just talking before, the treatments are not going to be possible to have if you have Omicron. They're not going to be as effective. So we want to make sure that those who can get access to some of the treatments do get access to it. And that's what your doctor can help you sort out.
They may not be effective, but could they or should they still try? How do I know if I want monoclonal antibodies? Or, and this is not to judge people where or how they get their information, they want to do what they think is best for them. If they think I need to get this virus out of my body, why not take something that I've heard called hydrochloroquine or ivermectin?
Well, Jonah, there's a lot of misinformation out there, and I want to clear this up right away. We need to only focus on medicines that work, that have been tested, and those are ones only that have been approved by the FDA for the purposes of treatment or authorized by the FDA for purposes of treatment. And the two you mentioned are not. So we'll focus on the monoclonal antibodies and others that are coming down the pike.
Is the National Guard, Governor, prepared to assist in hospital capacity? Have you put them on standby?
National Guard is always ready. National Guard is helping still in some places throughout the state and will up that if necessary.
And are you worried, and I guess this goes for you and for Secretary Cohen, is the threat more where you see overcrowding in the urban areas like a Charlotte, like a Raleigh, like a Greenville, in fact, or are you more worried about the capacity and especially the need to transfer people from more rural hospitals?
So in all parts of the state, your main concern is staffing and making sure that you have enough staff, whether it's an urban hospital or a rural one. That affects capacity more than anything else. And we are in constant contact with our hospitals, with the CEOs of these hospitals to help them manage their cases, their elective surgeries, and all of that so that they can be ready for this if it comes as expected. One of the reasons we are here today, even though we don't have the surge of Omicron yet in North Carolina, we expect that it will happen and we need to get ready for it. And because it is so contagious, and because we still have a number of unvaccinated people in North Carolina, we expect more people to have to go to the hospital. And we want to be ready for that, whether it's rural or urban areas. I don't know if you guys want to add to that or not. Okay.
Okay, last one, I promise. Thank you. And now for Governor and for either secretary, I want to give you an opportunity here to also say, when you are urging the booster and when you are saying that more people, even if you are vaccinated, that are going to get the virus, that does not mean the vaccine is not working.
That's right.
Correct?
Yeah, absolutely means that the main reason to get a vaccine and the main reason to get boosted is to make sure that you don't get seriously ill or die from this virus. There is less of a chance that you will get it when you're vaccinated. And particularly, we have seen that by getting boosted, there's a significantly less chance that you will contract COVID-19. But vaccinated people do get infected. But when they do, if they're vaccinated, and particularly if they're boosted, they have a lot more protection. And it's one of the reasons we are here today. Yes.
Hi, Brian Murphy with the News and Observer. Secretary Cohen just said that there may be as many as 10,000 cases a day, perhaps starting in early January, mid-January. Are you at all considering any statewide mandates at this point? Or what can you do? What's left in your menu of options if this does exceed 10,000 cases a day and we start to see hospitals get filled up?
We're here today to tell you the most important things you can do, and that's get boosted, get tested, get vaccinated. Those are the things that we want people to do right now. We are not at the point of any of those statewide requirements at this time. And the message is strong and clear. And we're seeing we have the benefit of knowing what has happened in other parts of the world and seeing what's happening in New York and other places in the United States. So we think that's the most effective way to approach this right now.
Have you considered what to do about particularly K through 12 schools? Would you like to see them adopt a test to stay policy, particularly for kids who've been vaccinated, in order to keep schools open and keep kids in that learning environment?
So I'll first say thanks to the educators and thanks to the parents and thanks to the students, what they've had to go through and how they're continuing to drive on to make sure children are educated. I think it is very important to try to keep children in the classroom, in-person learning. But as this Omicron wave comes, schools, I think, are going to have to step up their game in making sure that students are protected. And I may let Dr. Cohen say a word or two about that.
Just as a reminder, already before you even add testing to the mix, our kids can stay in school if they're doing some key things to make sure that they're not spreading this virus. One is getting vaccinated. Now, all of our K-12 students are eligible for vaccines. Really important, safe, effective. My two daughters who are 7 and 9 are vaccinated. Really important for folks to go out and get vaccinated. And if you have an exposure, but you're already vaccinated, you stay in school. So that's number one. Second is another layer of protection is wearing masks. So in those schools where we are seeing everyone wearing masks, very few kids are needing to be excluded from school because of an exposure. So there's already a lot of ways for folks to be able to stay in school. And now we have been studying right here in North Carolina with ABC Collaborative the test to stay options. And so we do think that's in a good layer of protection. So you have vaccines, you have masks, and then you add tests to that. I think it's really going to be able to have kids stay in school, but it starts with that most important fundamental protection, which is getting vaccinated.
While I have you, is there any sense for what's going to happen to kids under 5? Lots of us, including some of us in this room, have kids under 5. I know they're not at giant risk of developing serious illness or death from it, but they're part of the family and they're going to be traveling. They're going to be exposed to the same people that other vaccinated people are exposed to?
Well, the first thing we can do to protect our littlest ones are getting vaccinated ourselves, right? If we are all vaccinated, it's going to mean less virus circulating to our kids, number one. But what we're seeing in the vaccine development process, even just this week, we saw that the Pfizer team is going to need to go back and relook at the dosing for our youngest ones before they're going to be able to come forward to the FDA for approval. So a bit of a setback. And I think it just shows you we've been incredibly, the scientific community has been incredibly good at getting vaccines out, getting them tested, getting them into this process, because things, they will go through these rigorous scientific processes. And if they're not as effective as we want them to be, they need to go back and really rework. And that's what they're doing for our youngest ones. So up until then, we'll just need to get everyone else vaccinated. And again, I think the other tools that we've been talking about are important. Getting everyone tested before they gather, wearing masks. The things we know work are really going to protect our little ones as well. Thanks.
And one last question for me for Governor. I saw you released a tweet about the Build Back Better plan, which appears to have been at least temporarily delayed in Congress. Is there a particular aspect of that plan do you think is super important or most important for North Carolina and for what's happening in the state?
Access to more affordable child care for parents and employers. It's one of the issues now affecting people in the workforce. And in the Build Back Better plan, many Americans can get quality child care for 7%, no more than 7% of their income. And when you have working parents who are paying 25, 30% of their income on child care, it makes it hard for them. A lot of positive things in here, but they need to get back to the table in Washington and negotiate something to try to help people with health care, prescription drug prices, and particularly the child care.
Thank you.
Hey, Governor, Brian Anderson with the AP. It might be the last news conference of the year, and I really don't want to deprive you the opportunity to answer multiple questions from me. So forgive me in advance. But I just I'm a little confused on the overall tone of how this news conference is different from just 6 days ago. It seems like there's a lot more urgency. And I'm just curious, what's changed in the last 6 days?
Well, the real urgency now is boosters. We've got a lot of vaccinated people. I want to make sure about this number. About 38% of our people who are vaccinated have had their booster. So we know that we have to increase boosters because we've seen that the Omicron variant, you can get real protection from boosters. So that's a main message here. And I think this is the first news conference we've had where boosters is the main message. And the second message is testing. Those two things right now can help us get through this. And what's different is seeing that the real probability that Omicron will come here and will become the dominant variant. You want to add anything to that, Dr. Cohen?
Brian, the only thing I'd add is that we are learning more about Omicron, and that's what we said. We needed to learn, we needed to understand it, and what we see is that it's incredibly, incredibly contagious. Luckily, we see it's also likely less severe, but it doesn't mean that the unvaccinated are going to be protected here unless they get vaccinated, unless everyone gets boosted. I think that's what has changed in the last number of days. We are really seeing this incredibly fast takeoff in other countries and in the Northeast, and we want to take the opportunity, the fact that it's not dominant here in North Carolina yet, we have time to act, and we want folks to act right now.
And for the governor, Dr. Cohen said earlier that this is, quote, a moment to act. And Cody's also talked about the free testing, and I went through the website and saw how people could do that. Not dismissing the power of a secretarial directive or the expanded at home by any means, but there's a statewide mask mandate you could reimpose. There's tighter enforcement you could do of some of these vaccine encouraging efforts for state cabinet agencies. Why are you not using these tools at your disposal if now's a moment to act?
Because we want to concentrate on the effort to get people vaccinated. That's the most important thing we can do right now.
I heard over the weekend with WRAL that you said you support Sherry Beasley. I just want to clarify, do you personally today endorse U.S. Senate candidate Sherry Beasley?
I will be doing that, yes, but I'd rather stick to the health questions at this news conference if we can.
And QVC fire update, do we know the cause of it yet? What's the latest?
I know that state officials are working closely with local officials on this QVC distribution fire, and there is no report yet as of this moment that I know about that has established a cause at this time. Our work right now is trying to get people help with employment, trying to get people help these more than 2,000 families who are going to be without a job, and of course we mourn the death that occurred there.
You alluded to it earlier with efforts to improve corrections department vaccination rates for those officials. And I'm just curious to date, how many cabinet state level workers have been fired and dismissed under your executive order mandating the vaccine or the weekly testing and their failure to comply with that?
Well, first, I think they're going to be releasing the numbers, but it's somewhere between 76, 77% right now of all cabinet level employees that have been vaccinated. But the vast, vast majority of them are in compliance with the executive order. And that means either being vaccinated or tested. We can get you some more specific figures that I think they're going to be coming out with toward the end of the week.
And that those more specific figures, will those be number of employees dismissed?
I don't know. We can get there have been, that has occurred in some agencies, and some people have left, but the vast majority of people have chosen to get vaccinated, and then there are significant numbers who have chosen to get tested. But most people, the vast majority of people, are complying with the executive order.
Couple final ones for Dr. Cohen. Just with regard to incentives, we know that you had a $25 perk for families to get their kids vaccinated. Are you considering doing something like that at a statewide level to encourage participation for the boosters?
Great question. I think we are looking at all ways in which we can encourage folks first to share this message of urgency today, but certainly we'll look at other options. I'm certainly looking at that for our own employees, our own healthcare workers. But again, we have to just make sure we go through the proper channels before we make a decision like that. But I think we will continue to keep those options on the table.
If you're traveling for Christmas and at least one person in that household, you'll be maskless indoors in that type of setting. Should you go to that venue if you're with someone who's unvaccinated?
Of protection. And I recognize that these are hard issues to talk about amongst family members. But it's really important to have that conversation ahead of time, right? If someone's not vaccinated, let's make sure they get tested, wear masks, be outside. There are other ways to add layers of protection and all still be together safely.
Last one, 19,167 people have died at the latest count from COVID-19. In your opinion, how many of these were avoidable and unnecessary deaths? A majority?
Oh, Brian, that's a really hard question, right? Because this pandemic has gone on quite a number of months, and we didn't have all the tools we needed to the first year of this pandemic to really protect folks. And only in the last 6 and 8 months do we really have vaccine that was widely available. We're only now having treatments that are available as well. Every life lost in this pandemic is a tragedy. Preventable. I think there are a number, certainly in more recent time when we have vaccine and treatment available, that I wish we could have done more and done things sooner. That's why we're here today. Today, we're saying we need to have you get boosted to get the best protection possible. Please listen to all of the things in the secretarial advisory about how to be safe over this holiday season. We can get through this together. We will. But it's going to take all of us, again, working together, using the tools, protecting each other.
But
Thanks.
no active count of how many could have been avoided?
I can't say that.
Gotcha.
Thank you.
Thank you.
Okay, we'll go to the phone if there are people we have on the phone. Take the first question.
Our first question on the line is from Richard Craver with the Winston-Salem Journal. Yes, Governor, Secretary Cohen and Kinsley. Just following up on, I understand your desire not to do anything statewide requirements at this point, hoping that vaccinations and boostings will help take care of some of the issues. But if, as you go forward, given what the state budget had in terms of executive management authority going forward in 2023, do you expect to have active conversations with council and state members and the legislatures about when a statewide mandate may become necessary again?
So first, there are no changes to the executive authority that the governor has now or next year. There are changes that will occur in 2023. I generally talk with statewide leaders in the legislature and on the Council of State about decisions that we make. There are no statewide mandates at this point regarding COVID-19, and certainly we'll discuss with other state leaders decisions that we make about this pandemic as we go forward. Next question.
Our next question is from Kate Martin with Carolina Public Press.
Good afternoon, Governor and Secretary Cohen and Mr. Kinsey. I'm curious about vaccines for those under 5. A couple of questions, if you don't mind, since I'm not there to ask them right in a row. One, do we know the timing of the approved vaccines for people who are under 5? Are we talking weeks or months? And then, there's going to be a lot of folks traveling with young ones under 5. And I know this has, been asked in some respect already, but should parents of kids under 5 traveling to potentially like a mixed vaccination status party take considerations to maybe stay home, or like what are the things they ought to be thinking about right now if they want to keep their loved ones safe?
Thanks, Kate, for that question. I would say I think it is going to be a number of months until we have a vaccine that is authorized for our children under the age of 5. There was a setback just this week in some of the trials. And so I do think it's going to take a bit longer than we were hoping for. So I do think it's in the order of months now, not weeks. And as you as a family are thinking about holiday gatherings, you want to be having those holiday gatherings in the safest way possible. I would say everyone getting vaccinated and boosted, getting tested 2 days before, wearing masks, and keeping gatherings small are the best way to do that. We recognize that those under 5 cannot get vaccinated right now. The best way to protect them is to make sure everyone else is vaccinated, make sure everyone is getting tested. Our little ones can get tested as well. And then each family is going to have to make that best decision for them about what that means for risk, both for our little ones as well as the grandparents in the family or others in the family with underlying medical conditions. We certainly all want to be together at the holiday season, but I do think each family should figure out that risks for them, try to do everything possible to layer on protections. I think there are ways to have safe gatherings if you are able to follow the vaccine, boost, test, mask protocols that we've been talking about today. Thanks.
Next question, please.
Our final question that will conclude today's briefing is from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46. I'm interested in getting your reaction to booster requirements. Duke University announced theirs, granted it's a private institution, also another private institution here in Charlotte, Queen's University. They have announced plans to have a booster requirement as well. Interested in getting your reaction to that. And also there is the Captain Obvious question here as far as whether or not educational institutions, specifically those colleges and universities, should have a mandate in place. So I'd be interested in getting a response to that.
We're seeing more and more evidence about the effectiveness of boosters, particularly with the Omicron variant coming toward us. I'm going to let Dr. Cohen predict when she thinks that may be a requirement.
Thank you, Governor. So what I would say is you hear in the urgency of our voice about about everyone getting boosters who are eligible, particularly if you're over 65, get boosted. If you have an underlying medical condition, get boosted. If you are work or live in a long-term care setting, get boosted, and healthcare workers get boosted. But really, everyone who is eligible should be going to get boosters. As far as thinking about mandates and changing the definition of fully vaccinated, I anticipate that is something that will come in the early part of next year. I don't think we will see that before the new year, but let's not wait for that, right? We want you to hear our message that we don't need to wait for mandates. Please get boosted now. We want everyone to protect each other as we see this wave of a more contagious variant coming our way. Thank you.
I want to wish all North Carolinians across the state a peaceful and safe holiday. Merry Christmas and a Happy New Year. I hope you can find joy in this year's holidays and spend time with the ones that you love. I know that this can be a frustrating situation, but I am so grateful for all of the tools that we have to keep our families safe. Thank you so much.